Hello, my name is Dr. Brett Zemba, one of the doctors here at Louisville Spine and Wellness. Thank you for taking a couple minutes to watch this video. The purpose of the video is to explain one of the major four services that we offer here in the office. Everything that we do can basically be categorized into four groups. The categories are segment, posture, movement, and nutrition. I have videos on all of these, so please watch them, they're important. But this one's going to go over the postural part of our care. The postural part of our care is based in a technique called chiropractic biophysics. By far the most researched, published chiropractic technique that there is, been around 40-50 years. These published research papers are not just in chiropractic journals, but in medical journals all over the world. What they sought out to do was to create this, what is the optimum position of the spine? What is the ideal normal range? And that's what they came up with, an ideal spinal model. Just like blood pressure has a normal range, blood sugar levels has a normal range inside the body. This is the ideal normal range of the spinal column. Again, this was all created and based upon their research. To no surprise, the spine from the front should be straight. From the side, the neck should have a backwards curve, mid-back should have a forward curve, lower back should have a backwards curve. You may have a lateral curvature from the front, maybe scoliosis, maybe not. You may have a straight neck, we see that a lot, or a kyphotic neck, a completely reverse curvature of your neck, typically from car accidents. You might have excessive curve in the mid-back, excessive kyphosis, a flat low back, or a huge sway back. So the two major services that chiropractic biophysics came up with to get to this, to strive for this ideal normal range, are postural corrective exercises, immediately followed by traction. Postural corrective exercises are just that, exercises that correct posture. Two major intents there. The exercises do help correct posture. Another intent is to warm up the tissues. These tissues that we're trying to change are not just muscles, although they will change, but those deep supporting ligaments of the spine and discs of the spine. They're avascular, meaning they don't have a lot of blood supply, so the time frame that you spend in the postural corrective exercises are to get blood to the tissues to maximize the benefit of the traction. The traction, you start out and you go at least for 10 minutes, work up to 10 minutes, and then you ultimately try to get to this 20-minute time frame. Between 0 and 10 minutes, you're getting elastic changes. What does that mean? You're stretching the tissues. There's not going to be any permanent change in the tissue in that first 0 to 10 minutes of traction. The 10 minutes to 20 minutes, there is no benefit that research showed after 20 minutes, but between 10 and 20 minutes, you're getting plastic changes. And what I like to think about is a plastic molded formed bottle. We're trying to get to change and mold the spine to this ideal normal range. Understand these are full spine traction setups. Traction of the neck, traction of the mid-back, and traction of the low back at the same time. So understand that this is not an exhaustive list of what you need to do for the spine if you want to optimize its position. You have to get adjusted segmentally. Just because you get adjusted segmentally by a chiropractor does not mean this is happening. Very rarely does a segmental adjustment change the curve of the spine. It does happen. I've done it many a times, but even though it doesn't change with a segmental adjustment, doesn't mean that it shouldn't change. That's why this is a complete, unique, distinct service. But understand, the spine needs to move properly. Just because you adjust it segmentally, just because you move it properly, you change the curves of the spine, doesn't mean it is going to move properly. They all work together, and then obviously if you're not feeding your body the proper nutrition, your spine is not going to be to its maximum potential. Understand one of the major benefits of this is that your spinal cord is inside the spinal column. If your neck is straight or your neck is reversed, understand it's not just the muscles and discs and ligaments that are changing, it is the spinal cord also changing. There's a lot of research that literally shows the change in the function, the action potential, the nerve flow over the spinal cord when your spine is not in its ideal normal range. Some of you might be thinking, yep, I have an x-ray of my neck, I can bring that in, we just start tracking the neck. Unfortunately, if you want to look at your spine with this mindset, you have to see the whole spine. You have to see the whole spine from the front, you have to see the whole spine from the side. Let's say your neck has an abnormal curve. Well, you have to see what is going on in the mid-back. Maybe changing the curve in the mid-back is all you need to do to change the curve in the neck. So to be specific clinically, you have to see all the curves of the spine from the side, and you have to see what the spine looks like from the front. So if you're interested in seeing where your spine is compared to this normal range, go ahead and just call and set up for full spine x-rays. Again, my name is Dr. Brett Zemba with Louisville Spine and Wellness. Thanks for taking a couple minutes to watch the postural part of our care here at the office.